Do you choose Original Medicare or Medicare Advantage? For many people turning 65, those two choices look like a bowl of alphabet soup. Part A, Part B, Part C, and Part D, followed by Medigap plans F, G, and N. But the basic difference is really not that complicated. Think of Original Medicare as ordering dinner à la carte. You start with the main course, and then you select and pay for the side dishes you want, and you can eat at any restaurant. Medicare Advantage is more like ordering the combo platter. One private insurance company puts the meal together for you, but you eat at the diner locations within that restaurant's chain. By the end of this video, you will understand the fundamental difference between the two. Welcome back to Wealth Horizons, where we discuss practical ways to protect our money, health, and independence throughout retirement. This video provides general educational information and is not insurance, financial, legal, or medical advice. Medicare plans and costs vary by person, location, and year. Before enrolling, confirm the details with Medicare, your state health insurance assistance program, or a qualified Medicare professional. Now, let's pull up a chair and look at the menu. Once you have Medicare Parts A and B, you have two primary ways to receive your Medicare benefits. The first is Original Medicare, sometimes called Traditional or Classic Medicare. It is administered directly through the federal Medicare program. The second is Medicare Advantage, also called Part C. It is offered by a private insurance company approved by Medicare. Both must provide your Medicare Part A and Part B benefits. The principal difference is who organizes and administers your coverage and what rules you agree to follow. Let's begin with Original Medicare, the à la carte dinner. Your main course consists of Part A and Part B. Part A is primarily your hospital coverage. It helps cover inpatient hospital care, limited care in a skilled nursing facility, hospice, and certain home healthcare services. Part B is primarily your medical coverage. It helps cover doctor visits, outpatient care, diagnostic testing, medical equipment, and many preventive services. Together, Parts A and B provide the main course, but they do not complete the meal. Original Medicare generally does not include outpatient prescription drug coverage. If you want that coverage, you normally purchase a separate Part D drug plan. That is your first side dish. And because you share the cost of your medical care under Original Medicare on an 80-20 split, you are personally responsible for 20% of the bill covered by Original Medicare and 100% of anything not covered by Original Medicare, which can be substantial. For that reason, many people purchase a second side dish known as a Medicare Supplement policy, commonly called Medigap. Depending on the Medigap plan you select, it can help pay that 20% plus the leftovers left behind by Original Medicare. So your à la carte order may look like this: Part A for the hospital, Part B for doctors and outpatient services, Part D for prescription drugs, Part F, G, or N to cover most of the rest. Your main course and side dishes may come from different sources, have their own premiums, and arrive with separate identification cards. It is not the simplest meal to order, but it gives you considerable freedom to eat at nearly any restaurant you choose. For instance, with Original Medicare, you may generally visit any doctor or hospital in the United States that accepts Medicare, and you normally do not have to remain inside a private insurer's local provider network, and in most cases, you do not need a referral to see a specialist. This nationwide access is the defining attraction of the à la carte approach. You choose the restaurant, rather than having an insurance company give you a restaurant list. Now let's examine Medicare Advantage, the combo platter. You remain enrolled in Medicare and you must continue paying your Part B premium. But instead of receiving most of your Part A and Part B coverage directly through Original Medicare, you receive those benefits through a private Medicare-approved insurance plan. That company bundles your hospital and medical benefits into one plan, and most Medicare Advantage plans also include Part D prescription drug coverage. So, instead of ordering several items independently, you receive most of the meal on one plate, usually with one plan card, and many Medicare Advantage plans also advertise extra appetizers, such as limited dental, vision, or hearing benefits, over-the-counter allowances, transportation, fitness memberships, or other supplemental benefits. Those extras on your plate can be useful, but examine the serving size. For instance, a dental benefit may have an annual dollar cap, use a limited network, or require substantial co-insurance for major services. A hearing benefit may apply only to selected devices. An over-the-counter allowance may expire if it is not used by the required date. The appetizer may be included, but that does not necessarily mean it is unlimited. Medicare Advantage plans also have an important financial protection that Original Medicare alone does not have: an annual out-of-pocket maximum for covered Part A and Part B services, sort of a de facto Medigap. Once your qualifying expenses reach the plan's limit, the plan pays the covered Medicare costs for the remainder of that calendar year. The actual limit and the expenses that count toward it vary by plan. The trade-off for the combo platter is that the insurance company establishes the menu and the rules. An HMO usually expects you to receive non-emergency care from doctors and hospitals inside its network. Except for certain situations, out-of-network care may not be covered. A PPO generally permits you to use out-of-network providers, but you will ordinarily pay more, and the provider still has to be willing to work with the plan. Medicare Advantage plans may also require prior authorization before they cover certain services, procedures, medical equipment, or medications. Using our restaurant analogy, you may have selected the combo platter, but the manager may have to approve an expensive item before the kitchen serves it. Prior authorization does not mean the service will necessarily be denied. It means the plan reviews the request under its coverage rules before agreeing to pay. This is why you should never select a Medicare Advantage plan based only on a low premium or a list of extra benefits. You must check its doctors, hospitals, prescriptions, co-payments, out-of-pocket maximum, and authorization rules. Here is the entire decision in plain English. Original Medicare is the a la carte dinner. You receive Parts A and B from the federal Medicare program. You may add a separate Part D plan, and if you qualify and choose to purchase one, a Medigap policy. You wind up paying more in monthly premiums, but you gain broad nationwide provider access and more predictable expenses when strong supplemental coverage is in place. Medicare Advantage is the combo platter. A private company bundles your Parts A and B, and usually Part D, into one plan. It may include extra benefits and may have a low or even zero additional plan premium. But you accept that plan's network, cost-sharing arrangements, and authorization rules. $0 premium does not mean free healthcare. You must still pay your Part B premium, and you may owe deductibles, co-payments, and co-insurance as you use services. Do not assume that you can try Medicare Advantage for several years and then return to Original Medicare with any Medigap policy you want. You can return to Original Medicare during an eligible enrollment period, but depending on your circumstances and state law, a Medigap insurer may be allowed to review your health history, charge more, or decline your application. There are important guaranteed issue rights and a limited trial right in certain situations, especially when someone tries Medicare Advantage for the first time. But those protections do not apply to every future switch. That makes your initial decision more important than many sales presentations suggest. Neither dinner is automatically better for everyone. The a la carte diner may prefer broad provider choice at a higher monthly cost and the ability to assemble strong supplemental coverage. The combo platter diner may prefer convenience, lower monthly premiums, and additional benefits, and may be comfortable following a private plan's network and approval rules. The smartest decision depends on your doctors, prescriptions, health, budget, travel habits, and tolerance for unpredictable medical expenses. But if you remember only one thing, remember this. Original Medicare is the a la carte meal. Greater choice, but you assemble and pay monthly for the side dishes. Medicare Advantage is the combo platter. More benefits bundled together, but you order from the insurance company's menu. If this explanation helped clear up the Medicare alphabet soup, please like the video, subscribe to Wealth Horizons, and share it with someone approaching Medicare age. Because the best Medicare plan is not the one with the flashiest advertisement. It is the one whose costs, doctors, and rules you understand before you need care.